because I just found my copy. But I think it's important that you know who we are as humans. Because I think in academia, all too often, we disconnect ourselves as humans from the work that we do. And so I do like to talk about who I am. Before I do that, though, I want to start out with something positive. Just take one, two, three, 4, 5 quick seconds and type something in the chat you're grateful for. Like to start with something positive. Just one thing you're grateful for. Could be your beautiful weather in LA as opposed to the Midwest. Good, I see a bunch. Health, long walks, life, sunny weather. I love kitty cats. Family, children, working in an inclusive environment, music, yoga, food security, walks, dog health, God's love, good health, family, pets, coffee, vaccine. Excellent, excellent, excellent. All right. It's good to see. Keep them coming, keep them coming. You know, I think again, as you know, at the beginning we talked about, Norita talked about, you know, we're still in the middle of this pandemic. We're still on Zoom instead of in person. And so I know that it's hard sometimes to see the bright side. And, you know, I'm going to be talking a lot about resilience and about trying to look on the positive aspects and kind of, you know, flipping the script a bit and looking more at positive. So that's why I wanted to start out with something a little more affirming. So now to tell you a little bit about who I am. Okay. And for some reason, there we go. So just a little bit about my intersectional identities. I think that we often talk about intersectionality, we often talk about identities, but then as I think academics, as researchers, even as community activists, sometimes we other that. So we let other people talk about that, but we don't talk about it ourselves. So myself, I consider myself an activist academic. I've been actually working in the HIV field since 1985. Started out as a community activist in 1985. I was doing HIV prevention in psychiatric hospitals with adolescents. And it was a time when people weren't doing this much and really talking about these issues. So I've kind of done the whole gambit. Most of the early work was really as an activist, as a gay man. This is something that was impacting my community, my loved ones, my brothers. And so I needed to do something. Also, first gen low income. I used to not talk about this as much, but as someone who's been a professor since '95, even though I'm no longer in that space, I think that the journey that I took getting into a university, I applied to one university when I was in high school because no one in my family had ever done it before. So I was like, okay, I'll do it. If I get in, I go. If I don't, I won't. And that's something that continues on. And so I'm really glad that this conference also has a strong focus on really building the next generation and encouraging people to go into this type of work. I'm an artist, I'm an educator, a mentor, I'm a white cis gay man. I also own and recognize my privilege as a white cis gay man and also as someone now with more power and privilege as an educated person. I'm also a husband. My husband and I were about to celebrate our 28th anniversary. I'm a son, I'm an uncle. So these are all my identities. And I think it's important when we're doing this type of work that we spend some time being self-reflective about our identities and how we do or don't connect with others and how we can find commonalities with others. All right, so I'm gonna do another activity. See, I told you you're not gonna be able to just sit there and be bored. So look at these 2 yellow dots and type in the chat which one is bigger. The first one, so the first one is the one surrounded by the larger purple balls, or the second one? Which one is bigger? Yep. See some. I see some folks already know the answer, especially if we have any psychologists, especially social psychologists. Um, the two circles are exactly the same size. The one on the right often looks bigger because it's surrounded by the smaller circles, and the one on the left often looks smaller. The reason why I do that is that, life isn't about reality, it's about perception. And what I'm going to be talking about today is really kind of rethinking, as you all are going to be doing, the way that we're doing business, the way that we're doing HIV prevention and treatment. Because I think all too often, as someone who's been in this field for a very long time, and I know a lot of you have as well, we get so caught up in doing things one way. And so I really want to encourage people to think in very different ways, instead of the usual ways in which we think about the work that we do. So when we think about the current state of HIV, this is from a UNAIDS report, Global Estimates for 2019, and this is a report on young people in HIV. So in this report, they talk about the total number of adolescents living with HIV being 1.7 million, which could go up to 2.4 million. And in this report, adolescents are defined using the United Nations age of 10 to 19. Now, when you first look at this looks like a large number of adolescents, and every single number also translates to a person. And I think often in public health, we are so focused on the numbers, we don't think about the humans attached to those numbers. But the good news is that given that adolescents make up about there's about 1.2 billion adolescents in the world today. That means that 0.14 of adolescents, only 0.14% of adolescents globally are living with HIV, which means that 99.86% of adolescents globally are not living with HIV. And we're in a field where we focus on deficits, focus on health issues, negative health outcomes, and we have to, because that's how we get funding, right? If we wrote a grant and said 70% of people are not dealing with this, we would never get funded. So we do what we have to do to get the funding, to get the support, but we also have to keep in mind that there are often large numbers of people who are doing well. This is from that same UNAIDS report. And it was really interesting because this is a quote taken from there. Despite the progress made in the past 10 years with a 46% decline in new HIV infections among young people, the world is still behind on achieving targets. I would be celebrating that 46%. That is a very significant, especially clinically, difference. But again, we tend to focus on what's going wrong or what's not going so well. When we look at the US epidemic, unfortunately, we still see that most of the HIV diagnoses are among youth, are among young gay and bisexual men. We see here differences between young men and young women, and just the total numbers much higher among men than women. We also know that this disproportionately impacts Black, African American, and also Latinx, Latino men. The data, obviously, as you all know, is not that good when it comes to looking at transgender and non-binary populations. So it's very much in this binary framework. But some of the good news is the estimated number of annual HIV infections decreased among youth between 14 and 18. And these are data from the CDC. So that means something is going right. Also, if we look at trends among different ethnic racial groups, we also see that there are differences in terms of decreases. There is an increase among Native American and other Pacific Islander, but the numbers have been so low that small increases in those numbers make the percentages go significantly higher. So we do have some things to be thankful for, to be grateful for. Also, this is from the Trevor's Youth Mental Health 2021 project, and they talk and they give data on different forms of negative mental health outcomes. But I wanted to focus in on the fact that despite these challenges, young people list hundreds of ways that they're finding joy and strength. So affirming parents, music, LGBTQ support, celebrities coming out with pride, chosen family, video games, things like that. So, again, when we're thinking about moving forward with the work that we're doing, really honing in on some of the positives, aspects that are going on, and really finding some of the joy and the strength in life. I think the current approach that we often use to HIV prevention and treatment right now is pretty fragmented. I feel like we don't really look at adolescents and young adults as whole human beings. We focus too much on epidemiological terminology and really looking at people as vectors of transmission. And oftentimes, not everyone, but I think oftentimes there is a focus on either let's get someone on PrEP without thinking about whether or not PrEP is really good for that person and whether or not PrEP is going to have a positive effect given the whole range of other factors that young people are dealing with. And so I think that as we do also think more positively and more resilience focused, we also have to think much more holistically. Young people are resilient. Young people have resisted oppression in many ways. Think back to a lot of you, if you think about your own childhood. I think back to mine, and yes, I did have a tremendous amount of privilege as a white cis male, but I also had a number of challenges. And I think that a lot of us can look back into our own histories, our own lives, and think about how we would react to some of the prevention approaches and treatment approaches today. I always tell my students, if you wouldn't want to go through a program, then don't, maybe you need to rethink the program. Because yeah, coming to 15 sessions may not work, or having to travel across town may not work because of everything else that's going on. So I want to talk a little bit about resilience and resistance. And so the definition of resilience that I use and that my team works with is one by Ferguson Zimmerman that really comes out of public health psychology, community psychology, and it's really focused on adolescence. So in the Ferguson Zimmerman model or approach, you have to start off with adversity. So people who have not experienced adversity really, don't have kind of the need for resilience. So what they talk about is that there's a variety of different promotive factors. So these are at the individual level, and those are the assets. So these are positive factors that are internal to the person. So things like self-efficacy, self-esteem, competence, coping skills. But then there's also resources, and these are socio-ecological factors that are external to the individual. So these may be things like social support, mentors, CBOs, things such as that. Now, resilience is, I talk about it as a process. Ferguson and Zimmerman talk about it as a process because it's not an outcome. The outcome would be positive mental health. The outcome would be living healthy with HIV or staying protected from HIV. But it's really a process. It's not like you're resilient and bam, you're done. And so when we're talking about resilience, we have to think about the context, because there's some contexts in which we may exhibit a lot of resilience processes, and then others we may not. Also, the populations are very different. So what may be considered resilience within a youth population may be very different than with an older adult. Also, the risk and the threats are very different. So if we're talking about a health risk versus a psychological risk versus a future risk, those are different. And then also the promotive factors and of course, the outcome. So when I think about resilience, I really do think about it in this more complex way and really thinking about the outcomes as positive physical and mental health. But we also have to examine all the different ways in which these processes are occurring. So my team and I have been doing resilience work related to HIV for a number of years. Here's just a number of papers. We've been doing increasingly more in working in Kenya and Zambia with young gay and bi men in those places. We had actually just got another paper accepted yesterday about resilience processes among gay and bi men in Western Kenya related to the resources part of resilience. So really focused on social support and other ways in which connection to others and other organizations, entities, and people, how that helps. And actually one of your students at UCLA, I think, is working with Dallas. Kate is one of our co-authors on that. So all about promoting young investigators. Kate was actually an undergrad in our program and got involved in our research team. And so that's her second publication with us. So it's very exciting. Now, resistance is tougher. All right. Now, you may look at the slide and be like, okay, dude, did you like put the wrong slide in or what? So this is a little complicated. I'm not going to stress you out too much with this, but one advantage of being married to an engineer is that you learn a lot about different things that you normally wouldn't learn about. So when I've done a lot of work looking at how resistance is defined in social behavioral science, humanities, other related areas, and we don't really have a good framework for how we think about resistance. So a couple of years ago, I was talking to my husband about this, and we started talking about how does this look like in the natural sciences? What does resistance look like? And so this is out of science and engineering about transport phenomena. So resistance is really something that in the natural sciences, you're trying to decrease resistance. And in social behavioral, we want to increase resistance. So I'm going to go to the next slide to hopefully make it a little bit clearer. I've been trying to kind of connect social behavioral work to this kind of more, again, kind of natural sciences and engineering. And so what I've been really thinking about is how do we look at what is naturally occurring in the world and then translate that to human behavior? So yeah, again, and I had to kind of flip the script because in science and engineering, you're trying to decrease resistance so that you have better flow of electricity, of water, things such as that. So I've been trying to think about, well, how do we increase resistance? So part of what we've been looking at is social connectivity. And so this may be in terms of social capital. One of my former mentees and colleagues, Sophia Hassan at Emory, has done amazing work with this and has created an intervention for Black gay young men living with HIV, focused on social capital. It's called the B6 intervention. And D is distraction, so another factor related to resistance. And I think that distraction happens a lot in the world in terms of us really losing focus on what we're trying to achieve. And I think that there's a lot of forces out there that want people to lose focus because they want to break down their resistance. And I think that the more that we can remain really centrally focused. Also, I do a lot of work in the area of critical consciousness based on Paulo Freire's work. And a big part of critical consciousness is becoming aware of the oppressive forces that exist in society that are breaking us down. Part of how oppression works and how oppression is maintained is that we are not aware of all the oppressive forces that are negatively impacting us. And then resistivity is this concept too that they have in science and engineering that I've been really looking at it as resistive processes in terms of resilience, which are impacted by interrelated contexts, cultures, and history, so our environment, but then also the person, him, her, they, self, which a lot of that comes from Bronfenbrenner's work in adolescent development. So what does all this mean? Well, one thing when we look in the natural world and we look at ecosystems, systems are either resistant or resilient. So resistant systems, ecosystems are ones where they can withstand a lot of disturbance, but then once there's a really intense disturbance, they become broken down, dysfunctional, and they're severely impacted. At that point, it's really hard to recover. Resilient systems are damaged each time there's an exposure, but they can build back up again. So I think what we need to really be doing in terms of our young people is thinking about ways to promote both resilience and resistance at the same time. And so I'm going to put this all together into a little framework, and I know my time is running short. The model I'm going to show you has elements of Myers Minority Stress Framework, critical consciousness, and intersectionality. So I want to acknowledge those. So if we think about this in terms of general stressors, SGM is sexual and gender minority stress processes, both proximal and distal. We can help to build resistance processes at that early level. So things like social connectivity, social capital, critical consciousness, focused awareness, all these are different processes that we can build within young people to help them to combat some of that stress in the very beginning before it becomes more significant. Two of the factors that we've seen a lot in our qualitative work, and I haven't really written about this much, we've just been doing a lot of conversation about this, is self-love and mattering. One thing I've heard for years and years from, especially a lot of my work with young Black gay men, is that they feel like their lives don't matter, that no one really cares, they're just a statistic. And also self-love. There's so many ways in which people are taught early on to gain affirmation externally and not internally. And one of my former students and colleagues has a really beautiful paper on self-love and self-affirmation for transmasculine young people that's currently under review. So then, if there is, there's obviously those resistance processes aren't going to be able to stop every form of stress that comes. That's where I think the resilience processes then help come and reinforce. So the assets we talked about and the sources, those create resilience processes that will then help to combat some of those. Again, as I showed in the other diagram, context, population, risk, threat, all those are promotive factors. And I think self-love and mattering, again, is very important here as well. So, when we think about this and look at this, I always hate when people just create models to just put it all together and be like, oh yeah, look, I have a pretty model. I always think about intervention. So where can we intervene? So I think there's a lot of different ways in which we can be promoting both resistance and resilience in terms of trying to build up the ability of young people to be able to combat or address some of these issues. So I do have this is a model that I've been working on. We've used this in different ways in different projects. And I want to show you some about this, and I'll end with this. So this is really just kind of a basic framework for how we do intervention development. So a lot of us have done this. Needs assessment, ecological assessments. We develop our interventions, we pilot test them, we implement them, we evaluate, and then hopefully we scale up. I think some of the factors that are missing sometimes in that initial ecological system assessment is really a focus on resilience and resistance, mental health, and more of a holistic approach. I think for the intervention development and pilot testing, we need to really re-examine our theories. A lot of our theories are really rooted in white, Eurocentric, heterosexual, privileged male perspectives, and we need to really re-examine which theories are going to be helpful. In intervention implementation, young people need safe spaces, and they also need capacity building. One of the big concerns that I've had for a number of years is with this increased focus on PrEP within HIV prevention, we're losing community-based organizations which used to serve as a safe haven. So we don't have as many behavioral interventions in the community. Community agencies are finding it harder to get funding for more holistic programming. And so I worry about that some of the safe spaces for young people are going away. Also, in our evaluations and modifications of these interventions, we really need appropriate measures. Again, a lot of our measures are rooted in old concepts, old ways of thinking. Not many are really focused in the lives of trans, non-binary young people, other LGBTQIA plus people as well. So we really need to be examining those. And then with scale up and sustainability, we need more funding. We need more capacity building on that aspect. I mean, I know we all have probably had experiences of working on amazing projects and you get finished and the funding's over, and then where's the money for scale up? Where's the money for a continuation of those efforts, particularly in communities that need it the most? I think some of the factors that impact this at a more proximal or immediate level is issues around power, agency, and control. These are concepts we've heard in our qualitative work and just in my community work for a number of years. We need to help young people find their power and find ways to assert their power, and also to have agency, to make choices, to participate, and control. Trust, love, and respect. Again, this comes from just a lot of community work. All too often, academics are coming in and really doing a disservice to communities. We need to build trust. We need to make sure that we have trust across agencies and across people, and trust amongst older folks and younger folks. Adolescent development, trained in adolescent development, live adolescent development. I can't, it blows my mind how many people are working in the area of youth and adolescence that have no sense about adolescent development. I see Norita smiling. I'm sure you can relate. We really need to think about those factors. Then intersectional identities too. We're not just a sum of our parts. It's more complex. More distal factors, we need to be paying attention to multiple cultures, LGBT culture, race, ethnicity, geographic, faith. We need to look at structural barriers, also policies. And then, all of this needs to be influenced. This whole process has to have youth voice and choice. We've got to have young people at the table. It's not enough to just say, oh, we're going to do, a focus group or a community advisory board at the end. We really need to include them. And then I just want to end with this. This is, Dallas mentioned about working in the ATN. This is a model that we've been developing within the ATN with our members who are youth members of kind of a community advisory board, but a lot more active. And then other folks that we've been working together, one of which is Juan, who is a doctoral student here at UCLA too, another former MPH student. But this is just a model we're creating. We're working on the publication for this right now to think about how do we include youth throughout the entire process, and making sure that they have true voice and really have a place to contribute to the discussion. So I know I went a little over time, but that is all I have. So I'm going to stop sharing and then